Greetings to our listeners. SAOPA is yet again concerned about the health of our people, of our patients, and we would like to give you some well-informed information, as we know that this week's topic is stroke. Stroke is what, we have been discussing. Dr. Paduka discussed it, Julia, and today I'm just going to be giving you a presentation about how can one heal just by eating right and doing the kind of exercises that are for the kind of stroke that you have. My name is Thongs from Zealous Movement, and there we go, we're starting. Please, may I have the first slide? With stroke is you are more likely. What are the risk factors? You are more likely to have stroke if you've had it before. So you need to change definitely the lifestyle, and you need to get very active and eating right there. The kind of food that one needs to eat are very vital, especially when you've had stroke. And obviously, when you have an unhealthy and unbalanced eating plan or an eating habit, poor heart health is one of the other risks that can cause one to have stroke. Weight gain, we've spoken about that, and obesity, high blood pressure as well. So I think when one were to be able to change all that, one is able to lower the risk of having stroke before it comes, just by watching what you eat, just by watching what you eat. And then the kind of food that you could cut back on is it's sugar, which is very critical. As I've said, lifestyle changes is needed to prevent this kind of disease. And salt as well. Excess. Let me go back to sugar. Excess sugar, it's a no-no. It causes weight gain, number one, and it will take you to type 2 diabetes. So you don't want that, because definitely it will make the risk of getting stroke be higher than normal. So, and salt intake, one needs to not take it at all. Actually, I say that because you could use some kinds of like cayenne pepper. You could use cayenne pepper to put on your food. You could use some garlic flakes. You could use some herbs. You could use lemon to sprinkle, so that you don't want to eat a lot of salt, because then that will give you high blood pressure, and you don't want that. And if you continue to eat that, that will help you. Nutritional guidelines are very important. Highly processed food, you are better off eating the whole food, because highly processed food contains, they fortified them and they are refined, and that is not good for your body. Saturated fats and trans fats as well, fried foods as well, snacks. I mean, we'll talk about the kind of snacks that, instead of having chips and pretzels and cookies, chocolate, ice cream, etc., you could have like carrot sticks, celery sticks. You could have nuts. You could have some kind of crackers, So you need to watch what you eat. And as I always say, in terms of your food in the house, when you stock up on healthy food, so that you will want to eat healthy food. Sodas are a definite no-no as well. We know that they contain high sugars in them, like totally sky roof high sugars there. Energy and sports drinks that contain sugar as well, We don't want that. And, you know, believe it or not, fruit juice, you're better off juicing the juice yourself rather than buying the juice, because whatever that is on a shelf that has an expiry date, it means it's got some kind of fortifieds that are in there, some kind, they've done something to it for it to stay longer on a shelf or to stay longer in the fridge, you know. So you are better off juicing your own juice, you know, or drinking water, which I always say, and just because you need fluids when you've had stroke. You need to just spice up your water, as I've always said. The kinds of food that one needs to incorporate in your diet, you've got your fresh vegetables and fruits, and this is what we always say all the time: fresh fruits and vegetables, your whole grains, your legumes there, fish and poultry. And I want you to understand that there is no red meat, so we're trying to eliminate red meat. And then you have some fish there, and the poultry, the chicken, it must be the breast. You know, we don't want fat at all in any of the food that you eat. Unsaturated fats and monounsaturated and the polyunsaturated fats. Seeds as well, they are good, you know, nuts and avocados. So when I go to seeds, how you eat seeds, you can have seed on your low-fat yogurt because you're not allowed to have too much fat, so you can't have that double cream or the high-fat yogurts, you know. So on your plain low-fat yogurt, you can just sprinkle some seeds. There's flaxseed, there's chia seed, there's the mixes. I mean, if you go to a health shop, you would know that. Just go and ask what kind of seeds one can have. I mean, they know the kind of people that would come and what they would suggest for you, you know. And you could sprinkle some of the seeds in your oats. As I've said, I always say for your breakfast, one needs to eat oats. Nuts, you eat your walnuts, you know, and those are nice to snack on. So if it doesn't mean when you can't have chips and stuff, it means you won't be able to eat like nice food, you know. But be careful to buy salt that is not salted. You don't want salted salt. So just roasted salt, that's what you can have. And the oil from that avocado is what you need in your body. So we're gonna go to the benefits of exercise, but I wanted to mention that, you know, when you are eating in your vegetables, okay, you steam. We know that sometimes you are not able to eat, you know, the difficulty with eating. So what you can do is with your vegetables, broccoli, the greens, I always speak about the greens, you can just steam it. If you still can't be able to swallow, you can just steam it a bit and then blend it, you know, and mix it with the green beans, you know, some spinach, kale. Just blend that and be able to drink a smoothie so that it doesn't affect your throat. And we know that perhaps you don't even feel like eating, but drinking is better because the chewing, I know sometimes chewing as well is a difficulty to a person to eat, and we need to get you very we need to give you the nutrition that you need. So you need to have those vegetables. If you're not eating them, rather you blend them, or when you have steamed them, probably that they are nice and soft and easy to be chewed. That is that can, and you actually do want to chew, so that when you are chewing, you know, you are working the muscles in the mouth, you know, so that in the beginning you can be drinking, but as time goes on, it can be uncomfortable, but you must start chewing so that you can go back to chewing the food, you know. And then let's go to exercise. Oh, I've got slides down there. The exercise, the benefits of exercise is, let's go back to the benefits of exercise. The benefits of exercise, so one understands that it as much as it is difficult to get up and go do some exercise, but you need to. Why? Because it will speed up all the round stroke recovery. You will heal. As I've said, with all the other chronic diseases and every other disease that we've spoken about, when you will be amazed what you do when you just get up and go and exercise. So it will speed up the recovery process. You will recover your strength. It will improve your endurance. It will increase your walking speed. You know, because we know that probably the numbness on the one side, the one foot can't balance, or you are not able to walk. So when you continue to exercise, that will increase your walking speed there, and then it will improve your balance. It will boost the ability to perform daily routine activities, and it will prevent the reoccurrence. And that is the most, that's why we want to do this. It will prevent the reoccurrence of the stroke. You know, if you can't do it alone, you definitely must have a healthcare worker that is helping you. If not, you need to have a family member or a friend, or it can be, there must be somebody to come and help you, because we don't want you to fall, because falls after stroke in the first year, they happen often. And sometimes you may fall losing balance, and it may take you to, because remember, you're still very fragile. If you were to fall, you know, you are already in a state that I am recovering from stroke. And then a panic can make you possibly think that another stroke is coming. So you need to have a family member, you need to have some community member that would come, a friend, you know, somebody who will always come and help you, especially the first few weeks to months when you are recovering. You need assistance until you are able to get it yourself. Please, may I have the other slide? You see, you can still do some sort of exercise at the comfort of your home. You could walk, you could do some aerobic exercise. We need to do some strength training exercises. Remember, the muscles need some sort of workout so that they may come back and start working. The cardiorespiratory fitness as well is very vital. So you want to get mobility in everything that you do, you know. We can go up again, the next slide, please. Here are a few exercises that will improve the balance, especially after the brain surgery. You know, you could do some sitting exercises, sitting upright without support. You know, when you sit upright at home, because remember, you've heard almost paralysis on one side, so you probably slurred, and you know, but you want to sit upright without support. You continue to do that practice. That one you could do on your own, because it's something that needs your muscle to work. I mean, after you've had stroke, sitting upright, it's not as easy. It needs work. So you need to use those muscles. You need that power to make you sit upright. And then sitting on a less stable surface, you know, some ankle exercise, depending, I think mostly it's the left that is affected. You know, you want to do ankle exercises there. you know, move your foot up and down and try and see if you are able to rotate it, you know. And then you want to do the sitting to stand. Obviously, you don't move very far away from your chair, you know. You sit and then you stand upright and you sit. And because you have not been standing up to sit down immediately, so that exercise will take a lot of effort to do, you know. You can squeeze some pillow that will be for your fingers, you know, some gross motor there. And then stretching of the calves. You could just go on your tippy toes, you know, and go down and go on your tippy toes and go down. That's the heel and toe raises. You could do mini squats. Remember, everything that you're doing it's in moderate, because you don't wanna hurt yourself. Moderate, and then challenge your balance in standing, you know. You would want to sit down at all times, but you want to challenge and eat yourself in standing, and then reaching in standing, you know, try and reach. That's some sort. And you could still have your 500 mils of water bottle there, you know, and just because you want to use your muscles, just move it up and down, you know. You could stretch your leg, your arms, and, you know, just bring it close again in front, and you open. You can do this one sitting, because while standing it will need you to use more effort. You can do it sitting down with some weight, up and down, sideways, and can go up and down as well, you know, up and down. Or you could just get small dumbbells so that you are able to hold it nice, as perhaps the water bottle could be too big. But when you buy those weights, or sometimes you can get the weights that you can just wrap around your ankles as well, and your wrist. That will be advisable as well. Can I have the next slide, please? Your muscles. So these are the wrist curls that I was talking about, with some weights. So you really need to use that. It's very important, you know, because you want your hands to come back to working. And remember, exercise will definitely make you recover quickly. And you could, with consistency, you could go back to normal, you know. But as long as you exercise right and eat right, you know, there's more wrist and hand stretch. There are shoulder open, as I have been demonstrating. Table towel slides. You grab a table, you put it out there, you know, so that you can pull. You know, as you pull, you go down and you pull. Another slide, please. There we go. And standing up again, the trunk bends. Very important, you know. Knee rotations. This one, it's even better, because at least you're lying in on your back and you're more comfortable. You must have, as I've said before, you must always have an exercise mat. If not, you can have a towel so that you protect your spine at the back when you're doing any of the exercises that requires you to lie down, or lie down on your back, or on your tummy. There is a hip abduction there, knee standing, sit to stand, and hip curl. All of these exercises, they are literally going to help you recover quicker, you know. And the more you do it, the better, and you will become before you know it, so we are just saying to you, you continue to exercise, and that is very important for one to exercise. So let's just have a chat. This is just a round of chat right at the end. That when you must understand that salt will definitely do harm to your body. So when you take some of the herbs that I had mentioned, they'll be like your cure. They'll increase the water retention level in your system. That is the cayenne pepper, the onion flakes, and the garlic flakes. You become very creative. You could use some corianders. You must definitely have somebody to cook for you, because at the early stages of COVID, at the early stage of stroke, you are not able to cook for yourself, Olive oil, when I did research, olive oil is, yet again, it keeps on popping. It's very good because it's rich in vitamin E, and it's a monounsaturated fat. So I'd mentioned the monounsaturated fat and the polyunsaturated fat. So that can help you recover fast, and it will give the food an amazing taste. Do not put any of the spices if it's not the herbs, and as I've mentioned, so broccoli, cauliflower, Brussels sprouts, and peppers are what they actually suggest that one eat the most, because they are rich in minerals, in vitamins, and in fiber, because we do know that sometimes, because of the eating habits, or not being able to eat properly, therefore to go to the toilet is very difficult, and we don't want it to be such a painful thing. So when you eat these kind of vegetables, it will ease, because they contain lots of fiber. What you can do is you can cook your broccoli and the cauliflower florets. When cauliflower is taken off this little stem and it's steamed, it's actually very nice and soft. Just that cauliflower, and put some cayenne pepper, and chop up some peppers, and sprinkle some olive oil on there. That's a meal on its own, with some fish there on the side. If not, then you can just blend it and be able to drink it. And the fruits that you want to have are the apple, pear, and some of the citrus fruits. Earlier on, I mentioned that you can just sprinkle some lemon as a side, as like a condiment on your food. So that is very good for you, because that will improve the microvascular function, and it will increase the flow of fluids from the blood vessel to the body tissues. And as I have mentioned, real food are the ones that are whole, that you can see. There was a picture that you can see. It's your whole carrots, the green beans, the broccoli, something that is taken from the garden. You don't want to eat preserved food, because the minute it's not going to be good for your healing, because it contains something in it, and you just want to eat clean fruits and vegetables. They are very nutritious, we know that, and as much as they last less than the processed food, with processed food, and this is mainly for the person that will be taking care of you as a stroke patient, that you advise them that these are the kind of food that I need to eat, the fresh fruits, because processed food, they are refined, and they contain they are fortified, you know, and the benefit of whole food is because they are not fortified and they are not refined, and they contain, I mean, extreme nutrition. The thing about stroke is because now chewing is such a real reality in the beginning while healing. Therefore, the steaming, you can't chop it up and be eating it, as I said before. And the beans, if you cook them longer, then they become nice and soft. So what you can do is, with beans as a whole, you can just cook different kinds of beans and make a bean soup, you know, and you know that each time, when just before you have your lunch, you could just have some bean smoothie outright, because you can just blend them, and at least you know that you have eaten something just by taking as a fluid there, and have maybe a chicken breast, you know, or you can just, you know, play around your food and understand why we want you to eat more healthier than eating those processed food, you know. These real foods, they contain real nutrients for your body that your body needs for healing. And I think that will be it for today. We will be chatting again as next week. We'll be chatting about cancer, continuing to chat about cancer, but understand that if you've had diabetes, if you've had high blood pressure, and if you've had problem with weight, they are increasing the risk of stroke. And as we have said, you are better off to start, if you've never had stroke, actually, and let me talk about ages. You can have stroke at any age, you know, even kids could have stroke. So my fear is those kids that are I don't want to say obese yet, you know, that are gaining weight by not eating healthy. So stroke doesn't care how old you are. Although every 10 years that you add on, then it becomes, the chances increases. So you want to start eating healthy now. And obviously, if you've had stroke, then luckily for the family members, they can see you struggling and they will eat with you a healthy meal, you know, and that will lessen their chances of getting stroke. And then gender, we've mentioned that it's mainly men that get stroke, although women die from it, you know. So you want to watch that. The one thing that I didn't mention is you need to avoid alcohol, you know, alcohol intake. You need to avoid it. It's one of the high causes of stroke. And with ethnicity, they say Africans are more to have stroke rather than other races, the Aborigines from Australia, and the Asians as well. So I think we need to take care, especially as Africans, as in Black Africans, you know. And the other thing is mainly with the reason maybe Black die from stroke, it's because the therapies afterwards, or the rehabilitation afterwards, it's less, and the eating is what's okay, you know, eating, they tend to eat more of the white food rather than the fruit, the vegetables. And as I have mentioned before, start growing your own garden so that you can just grab whatever greens that you want from your garden. And then another thing is, what is it? I said at age, it doesn't matter how old you are, stroke just comes just like that, gender. both male and female ethnicity. And oh gosh, it slipped my mind, but I wanted to say something as well, just so you know that it doesn't really matter who are you. If you are where you are at the age that you are in and you've never had stroke, and you've had maybe the high blood pressure, you've had diabetes, you've had heart problems. So what you want to do is you want to start eating extremely healthy and exercising so that you don't get a stroke, you know. So yes, I think that'll be it for us today.